Hello, this is Dr. Lewerenz at Longevity Health Institute. Good afternoon. So, coming to you today, coming to you from Rochester Hills, Michigan, here at my Rochester office, and where we do the best in functional, integrative, personalized medicine, always getting to the root cause. Today, I thought I would speak on something that I saw a few people today that brought this up. We talk about this probably, unfortunately, almost daily or weekly for sure. And it's a very, very common problem that you even probably have dealt with at some point, and definitely many of your family and friends and people you know, because I have myself. And that's chronic or a semi-chronic neck pain. And why? Well, because we hold a lot of stress and there's a lot of muscles engaged in your neck and shoulders and trapezius. And so what can cause that? What are some of the causes of it? How does functional personalized medicine kind of work into that? But also, how can we naturally help it? But also maybe deeper, what does it mean? And that's stuff related to neck pain. So share this with others, by the way, because this is something that is so common. One of the most common reasons people visit a physician in the clinic is neck and back pain. So think about that. This could help a lot of them and save a lot of dollars. So let me go over some basics. So of course, anything you're doing structurally in your body, we have to consider the structure. Anytime there's a structural issue or pain, we always have to consider that structure. And that's one of our 6 systems that we physiologically always evaluate and appreciate here at Longevity Health Institute. So one of the things is that, so you need an x-ray typically if it's chronic, if you have neck pain that's lasting, more than a few weeks. Definitely if you have grinding or popping or limited motion, or God forbid you've had actually an injury or something traumatic, you need an x-ray. So of course, let's kind of leave that out into the orthopedic or physical medicine rehabilitation or chiropractor's hands, where they're the experts in it, and that's spinal alignment and bone issues and all that. Very legitimate, very real. Albeit, studies show that more than 90% of randomized people with neck and back MRIs have bulging discs and have, after the age of 35, some arthritis in their neck or back. So think about that. Most people have arthritis in their neck and back, and most people have bulging discs that are asymptomatic. And that's by studies. So that means there's a vector or trigger that causes that pain. So even if you have a structural issue in your spine, there's something else going on that actually causes that. And again, it could be overuse. It could be misuse if you're working out or lifting things or doing some stuff around the house. It could be just in general inflammation. So what would cause inflammation? So here at Longevity Health Institute, in my offices and my practitioners, we always want to look at the root cause of what can cause inflammation. One of the main root causes of inflammation is diet and digestive health. Now you're going to say, what? How does this connect to neck pain? Well, it absolutely does, because when you have inflammation in your body that's starting from bad diet and leaky gut and sugars you eat and gluten and inflammatory foods, that inflammation, loves to go to areas that have degeneration and have injury. So if you have any bit of arthritis or what in your neck, you're going to get pain when you eat bad or eat gluten or drink beer or eat a lot of sugar, And it often will come within 12, 24 hours right after you've had that intake of food, Or if you chronically have a bad gut, you very likely chronically have bad neck and bad, spine issues, The other things is that related to that is that you typically will malabsorb, and you'll have lower magnesium, you'll have lower CoQ10, you'll have lower B vitamins, things that actually have a lot to do with muscle inflammation and muscle integrity, So those are always things to consider. Now, what other system do we want to think of? And this is huge because I saw somebody today, And that is your adrenal system, and particularly your stress hormone cortisol. So cortisol, when it's really high in tons of stress, actually causes that wired and tired and anxiety kind of feeling, and kind of can't settle down, can't sleep well, can't calm down, feel agitated and edgy a bit. And that can make the muscles engage. This is obviously exaggeration, but people will do this, or they'll feel like they're doing this. And that compresses your trapezius, compresses your scalenes, causes a lot of occipital pain and tension. There's tons of nerves in your neck and shoulders that go up into your head and in the back of your occiput that can cause headaches, muscle stiffness, etc. Okay, so when you have high stress and have high cortisol, you'll tend to have a lot of muscle triggering and muscle inflammation. That alone can cause a lot of neck pain. Okay, in fact, we tend to hold a lot of tension, even just psychological and emotional tension, in our necks and in our shoulders. It's why what's the first thing you do when you get home with your loved one? If you're so lucky, is after a long day, they might rub your trapeze, they might rub your shoulders or rub your back, or someone that you care about, or if you get a massage, the first thing that feels the best is someone kind of releasing tension and relaxing those muscles in the trapezius, in the shoulders here, okay? Because we hold a lot of tension there, okay? Especially throughout the day and by the end of the day, okay? So that's something to consider. Although the direct opposite, lower cortisol. So you've stressed for months or years and you're pumping out cortisol, your adrenal goes, whoa, you're killing us, okay? You're killing us, Dr. Lewerenz. We're not gonna keep up with this pace. We're gonna make less cortisol, okay? And when you make less cortisol, cortisol is what? It's also your anti-inflammatory hormone. So now you have a lot of inflammatory cytokines and inflammation in your body. And just like a bad diet or bad gut, that inflammation can go to joints that have a little bit, albeit minor, inflammation and damage, and that give you trouble in the neck and back. So you got to think of your adrenals and stress and inflammation. You got to think of your gut, okay? And of course, ruling out and understanding what's going on structurally, whether it's an MRI or originally an X-ray or what have you, okay? Also, if you have structural problems, I passed this over a bit, but you're very likely to get muscle engagement. You compensate. So a lot of the muscles in your neck and muscles in the back of your neck and in your trapezius and even down your back in your rhomboids and into your chest here and your what's called sternocleidomastoid. These muscles actually then can overcompensate and get over-engaged. When they get hyper-engaged, they can get really angry because they're firing at a rate or at something that's not typical. Now this is where things like that are lovely like magnesium or heat or lavender or just massage, gentle or deep tissue massage, it really can alleviate that, okay? Because that's that muscle that's really fired up and spastic, okay? So those are some things from a functional standpoint. Now also hormonally. Hormones play a huge role into neck pain. I see this all the time, week after week, with men and women going into andropause and going to perimenopause, where they start to lose progesterone, and men, we lose DHEA and we lose testosterone, and these can then give us inflammation and trigger pain, okay? These are something you have to be appreciated and looked at when you have chronic neck pain or chronic headaches or chronic back pain, is all your hormones. Your adrenal hormones, but also your sex hormones play a big role there, okay? The other thing is, and this is another system that we always talk about and appreciate, is what is going on in your life, psychologically, emotionally. Common things, I see this a lot, are when people actually have chronic ongoing stress, not only will they hold that stress in their body and in their traps and in their neck and give them neck pain and neck tightness and stiffness, okay? But they also, that's a sign often, and I say this, that they don't have a voice. What I mean by that is with the stress, they're internalizing a lot of this stress. And when they internalize a lot of that stress, you actually can engage and hold on to it. And it's psychological and emotional, but it's actually very real, okay? There's a saying I have, if you have a lot of neck pain that can't be figured out, and you've looked at other systems and you've been told that you don't know why you have neck pain, you really might need to see and talk to somebody, whether it's a priest or somebody spiritual or a counselor or a loved one, and really open up your heart and get to like things that are bothering you, because some of your stress and anxiety and tension you have that you're holding internally is kind of saying you don't have a voice. When you have a voice, you can release these things and the shoulders drop and neck pain can improve and get better. Definitely something to think about, okay? Something to think about. Today, sadly, when I spoke with somebody, they had a lot of these things. They had low cortisol, they had a little bit of arthritis, they had a lot of stress going on in their life, and felt like that in some parts of their life at home and at work, that they didn't have a voice. and that was causing a lot of turmoil on them, giving them a lot of tension in their neck. We're going to work on that. She's fairly new, and we're going to be very successful with her because it's very obvious in our systematic approach how we can help out her chronic neck pain. So these are things to think about. Now, of course, we have wonderful supplements that we usually direct people to. Once we don't want to band-aid them, even naturally. Even natural band-aids aren't the right thing. You want to use things, excuse me, that correct the system. We want to correct the system physiologically because then you're healthier, and that's permanent. But yes, of course, magnesium, glycinate or malate, wonderful as a muscle relaxer. I mentioned a few B vitamins. Curcumin, which is the extract from the turmeric root, in high doses, is lovely as a anti-inflammatory agent. That's great. Okay, we spoke about here often and use CBD for inflammation and pain. It's very dose dependent, and your quality matters of your CBD. Of course, we carry only the highest grade CBD, full spectrum, organic, American made. But it is very unique to the individual, the amounts that you need and how they affect you. But inflammation and pain, CBD can really help, especially, okay? But again, those are band-aids. There are things that can help you and get you through and bridge you to fixing what the problem is. And then, of course, there's physical therapy and massage and all these things, too, that can help out. And I'm not naming all the supplements. There's cat's claw. That's a very good thing for pain. And occasionally we'll use an autoimmune disease with pain and inflammation, something that I spoke about in a video before called low-dose naltrexone. And you can watch my other video on LDN or low-dose naltrexone because that's lovely to really help out balance inflammation in the immune system. But again, these are things that all have to be considered to solve chronic conditions that have plagued and bothered some people for decades, okay? And really can really hinder lifestyle and happiness and work and relationships because they live in constant pain. So it's share this with others and spread that because those are all things that definitively can get to the root cause and the bottom of neck and back pain, especially neck pain. The one thing I want to mention is too, if you're going to a massage therapist or physical therapy or a chiropractor, and they're lovely, they're doing the best they can do, what they're trained in, they're experts in, okay, and you should go. But you're not really getting anywhere. Or they're using terms like, well, you've kind of maxed this out and you're not holding adjustments or the such. There's something deeper. There's something deeper going on. Doesn't even have to be structurally like a disc or a herniation or something nerve. Okay, it could be these physiologic, hormonal, adrenal, gut, inflammatory systems or psychological stress systems, that are all playing a component into why you have pain and neck pain and inflammation. So consider all that. The other thing I'm going to mention at the end of my video here is, surprisingly to me, I was nominated and elected to the Our Magazine Top Docs in Detroit Award in family practice this year, 2019. It was a shock, actually. I know several people have been in here that I respect and are well, but I appreciate that. And that was nice to be recognized by other physicians in Michigan and other hospitals as one of the prominent top physicians in family practice and general medicine. So, and you know we do more than that. We get to the root cause besides do general care and primary care. So again, this is Dr. Lewerenz, Longevity Health Institute. Our supplements I mentioned, you can go to our website, be linked to our warehouse, use the password code HEALTH for anything that you're interested in that we spoke about in this video. Still accepting new patients here, have several practitioners, a few locations. Keep following us and share with others. Subscribe to our channel. I'll keep teaching you and keeping you informed and keeping you well. This is Dr. Lewerenz. Be well.